And for more on that, I'm now joined by Margaret Harris. She's the spokesperson for the World Health Organization. She's on the line to me from Geneva. Dr. Harris, thank you. We heard there that Guinea has now been declared Ebola-free. Has the official statement been issued yet by the World Health Organization? What's the next step?
The next step is that Guinea now goes into a period of heightened vigilance. Yes, Guinea has achieved this really, really important milestone, interrupting transmission, as your reporter said, a transmission that started 2 years ago. But we now know that it does persist in some people who've recovered from Ebola, and we now know also that you get flare-ups, very, very small clusters of cases, but these are likely to happen. So now the crucial thing is that Guinea remains very, very vigilant so that ideally they can prevent any further transmission. But if it does happen, they detect it early and they respond early. And the other countries that have ended transmission have managed to do this, and we're confident that Guinea will do this too.
Dr. Harris, so what challenges now remain, though, concerning the Ebola virus in West Africa?
As I just mentioned, this issue of flare-ups, where we know now that it does persist in some people who've recovered in their bodies, and occasionally that means that perhaps where somebody has a relapse, it's possible for them to transmit it to close contacts. Now, this isn't happening very often, and when it does happen, because the countries are very vigilant, they detect it and stop it. But the other important thing for the people who've recovered is that they get access to medical care, and they get a lot of psychosocial support to go back to their normal lives, because they have been treated with a lot of stigma in some communities. And it's important to remember these people really are heroes. You get Ebola because you try to help someone. You try to care for them. You try to help them to go to hospital. So anyone who's been infected with Ebola is a person who tried to help someone else. And it's very important that they now be given the help that they need.
Dr. Harris, you do mention there that there is now a heightened level of vigilance in those countries that were affected by Ebola. But we know Liberia, which had been declared Ebola-free, is now the last country battling the disease. Are we expecting any resurgence, or is this now seen as the final push to free West Africa of Ebola?
Well, it's good that you mentioned Liberia, because indeed, yes, we've seen 2 flares since Liberia ended transmission in May. We saw a flare-up in July, and we've seen another flare-up in November that they're just dealing with. And again, after each flare, we say, watch for 2 incubation cycles of the virus. That's 42 days. And when that's ended, we call that flare over. And in both those cases, both those flares, they did have a few cases, but they stopped them very quickly. So that shows that these countries are very vigilant and are dealing with these flare-ups in the correct way. We expect, as I said, we do expect more flares, but we do expect them to decrease and become less frequent. And with this vigilance, with this really taking action to prevent, detect and respond to any flares, these countries will overcome this massive outbreak.
Dr. Margaret Harris joining us there on the line from Geneva with that update.